Today's the deadline for healthcare workers in New York State to receive their first vaccine dose. As News Channel 34's Karina Capabianca shows us, with the healthcare industry already dealing with staffing shortages, some are uncertain of what tomorrow will look like.
We're taking all the steps preemptively in anticipation of what I call a preventable staffing shortage.
Governor Kathy Hochul is signing an executive order that will allow her to deploy medically trained National Guard members, retired healthcare workers, recent grads, and those licensed in other states and countries to step in over the healthcare worker vaccine mandate. She's also working with the federal government to try to expedite visa requests for medical workers as well. New York State Public Employees Federation President Wayne Spence says while he hopes the governor's plan is sufficient, he doesn't think it will be.
I don't think that there's enough people to go around to plug the holes, because a lot of nurses have left New York State as of last year.
United University Professions President Fred Cowell says when it comes to tomorrow's potential impacts, there are a lot of unknowns.
We support the governor's mandate. The vaccine mandate, I think, is an appropriate step and a necessary one in the fight against COVID. At the same time, what we are looking at is potentially, hundreds and hundreds of healthcare professionals and support staff not being at their workstations starting tomorrow.
After a legal challenge, a judge put a temporary restraining order on the mandate in place for those claiming a religious exemption. In Albany, Karina Capabianca,